Hello there, this is Dr. Mintz. This is a case of a patient with congestive heart failure. And we don't see this very often on CT. We usually see it on chest radiographs, which are quite adequate for making a diagnosis. But this shows us a little bit more detail, and that's what I wanted to share with you. So, let's just look over the chest, make it a little bit lung related here. And we'll go down through the bottom and come back up through the top, give you an overview of what we're going to be looking at. So, first of all, there is pleural fluid on both sides, and if you use a regular soft tissue window, you'll see that there's pleural fluid on both sides, typical of congestive heart failure. Interesting though, what we also have here is what we call pseudotumor, a pocket of fluid in the major fissure that on a chest radiograph could well look like a mass, and here you can see it on a lung window, and what it really is a pocket of fluid, and up here you can see that it does look like fluid tracking in the major fissure, but here it has this kind of ball or mass-like appearance, and then as you follow it down, still has a little bit of that elliptical configuration, and then it flattens out. So a good example of what it is people are talking about when they say that there looks like there's a mass, but it's actually just a pseudotumor fluid in the fissure. And it can be in any of the fissures, major fissure or right minor fissure. What else do we see? Well, look at the lung bases, and you can see these coarse interstitial opacities, like here, these lines, these little interstitial lines that are prominent, and that's edema in the interstitium. And this is also what creates the appearance of curly, that's K-E-R-L-E-Y, curly B lines in the lung bases that we see on chest radiographs. Also, if you look in the upper lobes, these vessels look prominent. Okay, they look big. Overall, the upper lobe vessels look more prominent than you'd usually expect. Now, the patient is lying down, so that will equalize things a little bit. But overall, the vessels look distended. And if we look at a soft tissue window like this, you'll see that some of them are pulmonary veins. So here we have the left atrium, and we go up. So this is a main pulmonary vein coming from the upper lobe. Let's see if I can window that a little bit better. That's a pulmonary vein there. And if we go up, we'll see that this is one of the branches from the left upper lobe draining into it. So this is a pulmonary vein, and even though the patient's lying down, this part is up higher than this part. So it takes a fair amount of back pressure to make this venous structure, and some of these other ones here, some of these are veins too, distended like this. So this is what you're seeing here is what we call pulmonary vascular redistribution, and we see it on chest radiographs, but here you can just see that there are prominent upper lobe vessels bilaterally. The heart doesn't look particularly enlarged, and it doesn't have to be, but it is big, it's abnormal, but you can get congestive failure in a patient with a normal size heart. For example, if they have an acute heart attack, they can come in with failure. So, let's see how in a coronal series that might look. Let's see, there we go. We have a nice view here of some of the upper lobe vessels. See, so this is what you see on a chest radiograph when you see pulmonary vascular redistribution. And you can see it a little bit more sharply and clearly here, and you can determine that some of them are venous. And here you have that pseudotumor, and here you have, of course, the left atrium. So these are pulmonary veins draining into that left atrium from the right lung, and then they'll be coming in also from the left lung here and up here. This is that fluid tracking in the major fissure. Big left atrium, big left ventricle, relatively. Okay, and you can even see that there may be some right heart failure because the contrast is just not getting into the heart as quick as they expected. So after the injection, they expected it to be more fully into the vascular system, but it's backed up because the heart just cannot keep up with the rate of injection that was given to the patient. Sometimes you'll see some reflux like this down into the inferior vena cava because the pressure of the injection is overcoming the pressure of the returning blood in the inferior vena cava. So just a little overview, kind of a quick glance at congestive heart failure, an unusual example because we have the opportunity here to see it on CT. Here is the sagittal plane. There's the fluid tracking in the major fissure on the left, producing the so-called pseudotumor appearance. Okay, that's it for now.